Diolch. Noswaith dda, Margaret ydw i, dwi'n byw yn Dimbych, I'm coming from Denby, representing a Clwyd community enterprise. The final question, how are you going to address and solve the issue of long waiting lists for services, in particular with CAMS and other mental health services for young people?
Diolch, Margie, and Gareth Williams, Conservative.
Thank you. Currently in Conway, in the county of Conway, a suggested waiting time for a new referral to CAMS is 5 years, which means that a child entering their teens, if they come up with a need to go for CAMS, by the time they've actually got a referral, they're out of education and out of the age bracket for the CAMS service. That means that child would have suffered through potentially the hardest time of their school life, their teenage years, the stresses of exams, before actually being eligible for any support. And that's just not acceptable. The whole process is unpleasant. It's an unpleasant experience for the parents, if nothing else. And there's, I think, a lack of awareness that means that an over-reliance on CAMS and a lack of understanding of what other options are out there. I used to be a teacher, and I was fortunate enough to spend some of my early years in teaching in a school that specialised in autism. We had the autism hub for the county, where the 5 most needy children came to the school in the hope that they could interact with mainstream classes. I was a mainstream teacher, and although definitely not an autism specialist, the things I picked up from interacting with those specialists were vital, and they meant that throughout the rest of my career, I was able to handle situations that didn't require outside help because of the little tips and tricks and experiences I'd picked up. Empowering our teachers and staff within the schools is vital to help bring down the demand on CAMS. The Welsh Services would review the legislation, support arrangement for pupils with additional learning needs, whilst establishing an all-Wales education advisory service to promote good practice within schools.
Gareth, thank you.
Thank you.
Carley, Murdoch, Dyson.
Thank you. Our young people are our future, and so we really do need to start investing a little bit more in them, I think. And from a Green Party perspective, we would look to implement a youth mental health plan. In addition to this, expand school-based support as well, so we can help people potentially where they most need it and where they spend a lot of their time. And along with this, we'd create early intervention pathways for what's being described as the missing middle. So that's people that fall between the universal services and then the specialist CAMS support that's available, or eventually available. And also, when I answered one of the other questions, I spoke about prevention being key as well. And I really do think that investing from a prevention perspective will help costs in the long term. I appreciate it. That particular thing won't help in the longer term, but if we can then free up for the mental health cases that are preventable, that are maybe driven by the stress of people's daily lives, the cost of living is obviously a huge issue at the moment, then that will naturally start to free up money and resources for those that have the kind of mental health issues that need a bit more specialist support and that aren't preventable. So yes, we would shift investment towards prevention as well as early intervention and integrated care as well, so that people can have everything addressed that they need to without going around multiple providers. And yeah, so we'd look to ensure that people are guided to the right services wherever they enter the healthcare system, so there won't be situations where people are told you can't go, we can't help you, so you're going to have to go on this other waiting list over here. So yeah, we would try and prevent that happening.
Thank you. Carolyn Thomas.
Thank you for the question. I was a member of the Children and Young People's Education Committee, and this has been raised so much with us when we've done inquiries. It is a key priority for Labour, as well as a pledge to transform mental health care to provide easy access, same-day services, so everyone can get the right support for when they need it. More people are presenting as neurodivergent, and we want to ensure that longer waits will be ended for neurodevelopmental assessments for both children and adults. It's a specific pledge in the manifesto, and we also need to support families while they're waiting. We have been training, as I said earlier, more mental health nurses and specialists. I know the UK government is rolling out youth hubs. There are going to be 12 in Wales, 1 in Wrexham and Denbighshire, aimed at helping young people into work and training, working with the DWP, but there will also be mental health support in those hubs as well, because that's seen as really important. I believe tackling loneliness, isolation, and giving that sense of belonging for children as well is really important, especially post-COVID. Having that child-centred approach to education as well, as everyone learns differently. We need access to make sure that there's access to TAs in school. The schools, the TAs are so important. They do the nurturing and support. So we'll make
30 seconds.
We will make sure that they will be funded not just in term time, but all year round, so that we can have them in our schools. I talk about access to public open spaces and nature. It really makes a difference for young people. And if you can connect with nature, it can really help your mental health. Investing in grassroots sports is really important. Basketball is the fastest growing sport amongst young people. They can just turn up at a mugger, and before long they're there with other people.
Thank you, Carolyn. Much appreciated. Llyr Gruffydd, please.
Yes, well, the number of young people presenting themselves, with mental health challenges and issues is increasing at a rate of knots. And, we, as I said at the start, when we addressed this in a more general sense, we are committed as a party to ring fencing and protecting the mental health budget. But of course, we have to address it at its root cause. And the preventative approach is absolutely essential here. We through our cooperation agreement with Labour, actually, allowed the hub in Bridgend, the mental health drop-in hub, to happen. There are more on their way, and let's hope that continues until nearly all communities have that kind of service where young people can turn up. I was a youth worker for the first 7 or 8 years of my career, and youth clubs as they were, they're gone, aren't they? There isn't half as many as there used to be, but they were there to pick up the signs and the signals and to signpost and to support young people before they got to a point where they needed more significant support, CAMs, etc. So, harmful online content is an issue. Teachers are telling us that they're spending more time dealing with their pupils' mental health challenges than actually teaching in some context, and that's difficult, isn't it? So we want to develop a framework that brings together schools, health and care services and youth services in a sort of wraparound approach, so that we can try and offer those young people the support they need at the moment they need it, and not have to wait until they're so ill that they have to access CAMs. Now,
30 seconds.
Mentioned earlier the cliff edge, then the transition from CAMs to adult mental health services, that needs to change as well. And, I support a ban on smartphones in schools, and Plaid Cymru is committed to making sure that schools and local authorities have the power, or are empowered to do that, because I think the evidence proves that is, a big part of some of the issues that we need to tackle here.
Diolch, Llyr. Louise, Emery, reform.
I think it's a two-part question. The first is about reducing the long waiting lists for CAMS referrals, and no matter what it is, there's long waiting lists for all sorts of medical conditions, physical and mental. And so reform understand that we need to fundamentally, particularly in North Wales, make Betsy Cadwaladr work better as I say, there's 20 points in our manifesto of how we're going to do that across all trusts. But one of the things that reform will do is have political accountability, as the politicians will be able to step in and link pay and contracts for health board leadership to actual outcomes. So we feel that with strong leadership and a change of culture in some of our health boards, that actually they can be much better run, and a better run health board is going to hopefully reduce long waiting lists for CAMHS. In terms of other mental health services, I think we've talked about getting in there from the early doors in the education system. We have 12 points of what we'd like to do with Welsh education, and 2 of those, one is reviewing the ALN system. So we support special schools, and we ensure mainstream teachers, as Gareth was talking about, are not left sort of to manage complex needs without support, or also have that training where they can spot those signs early on. We'll build on the support for mental health in the current curriculum. We're very supportive of that part of the Welsh curriculum, not all of it, but we like that part of it, and we want to ensure that Welsh schools continue to promote mental health along with physical health. And I think majority of schools do have that lesson.
30 seconds.
My children certainly have a lesson once a week, which looks at all the other issues around being a teenager, particularly, that isn't just subject-based. And I think that is very important. Thank you.